Recovering from a hip replacement doesn't just happen in the first 6 weeks after the operation. What should you expect in the weeks and months still to come?
Most patients, by 6 weeks after their hip replacement, will find that they're getting around the house fairly easily. They'll be able to walk outside, although maybe for limited distances.
You start doing more and more normal things. You can lie on either side now at night time, and you don't need to have a wedge between your legs. One would expect you to be able to return to do your housework and all your normal household chores, and most people are able to drive by 6 weeks.
And by 3 months, most people are sort of 90% to full recovery.
So don't forget that recovering from a hip replacement isn't going to be a quick business for everyone, nor will it always be pain-free.
Most people will be heading in the right direction, but not everybody. And improvement can continue for a long, long time. 6 months, 9 months, 12 months, you're still gaining strength in your muscles.
The recovery of my first operation, I was very bruised and very swollen from my hip right down to my toe, and the back of my calf was extremely painful.
You will of course have some minor discomfort. This can continue for several weeks, and you will have a sort of continual discomfort just from around the scar. It's not normally in any way disabling. It can be a little bit of an annoyance, but it can easily be controlled with some minor analgesia.
If the pain is severe, then that could be an indication that there's a problem brewing, and it's very important to go back to see your surgeon and let them know that the pain is getting worse rather than getting better. You would expect it to get better.
The first thing is don't panic, because everyone does recover at a different rate. The other thing though is don't ignore it and contact us.
Some people still have discomfort beyond that, and that can continue to improve for up to a year, and some people have some discomfort long term.
The operation went well, but there was still some residual pain that I have had ever since. We're now 18 months on, the pain is still there, and although it doesn't limit me in most things I can do, but it's just always painful, so that hasn't been quite as successful.
As you return to your normal activities, you mustn't forget that having a hip replacement does mean that some things have to change, and that change will last the rest of your life.
The advice we've previously given about getting into awkward positions, particularly bending very low, still holds, and that should hold for life really.
You should always get down to your feet in a particular way and sit down in low chairs in a particular way. Then you do not put yourself at that risk of dislocating, because once you start to dislocate, it can carry on because you tear all the tissues at the back of the hip, and then you're heading towards a revision.
If you are careful and follow the instructions that the medical team have given you, the risk of dislocating your hip will be very small. But don't think that being careful means wrapping yourself in cotton wool and doing nothing.
The most important thing is to continue exercising to build up your strength. That may be in the form of the exercises that you will have been taught.
Prior to my first one, I probably did very little exercise because I was in quite a lot of pain. But prior to the second one, very important. You're strengthened every day and you can feel the difference. The improvement is great.
You should never stop doing your exercises. You should do them every day for a minimum of 3 months, and then probably 3 times a week forever.
Equally well, you should do regular exercise in the form of walking. You can start gardening. If you play sports, we would be quite happy for you playing golf.
Ideally, things like swimming, exercise bike, cross trainers, very good.
Our only caveats would be that you should probably be rather careful with anything that involves violent twisting, so for instance competitive tennis or playing squash. And the other thing to avoid is any form of high impact activity, and I certainly wouldn't advise anyone to sign up for the London Marathon.